952.
Welcome back to Get Down to Business. We are the show all about small business jobs and entrepreneurship. So a recent study by the Harvard School of Public Health studied and analyzed the care that's being provided by physicians that were trained here in the United States and physicians that were trained abroad. And here to join me to discuss that study is Dr. Fred Jacobs, the chair of the Department of Medicine and St. George's University in Grenada, which sends hundreds of doctors to practice in the U.S. annually. Dr. Jacobs, thanks for joining us on the program.
Thank you for having me.
Absolutely. So let's talk about the study and how it was conducted first. I know that there were a number of factors that were analyzed, including readmission rates of Medicare patients and mortality rates. Tell us a little bit about the process that was used by this Harvard study.
Right. Well, the Harvard School of Public Health did this very exhaustive study. They actually looked at about 1.2 million hospital admissions of Medicare patients who were 65 years of age and older, of course, who were treated by over 44,000 doctors. This is a very large amount, and they looked at the actual mortality of those patients who died within 30 days of being admitted to a hospital and analyzed that against also readmission. Now, readmission rates and 30-day mortality are standard types of indicators which people use to judge something about the quality of the care given. Certainly is not everything, but it's a good surrogate for quality. And what they found was, compared to U.S.-trained doctors, those doctors who trained at international medical schools had a slightly lower mortality rate than those who trained at U.S. schools. Now, the actual difference in the mortality rate was very small. It was statistically significant, but it was very small. But I think the takeaway from it is not that there was a lower mortality rate for those patients treated by the international graduates, but that it wasn't higher, because everybody, I should say everybody, but many in the United States academic medical circles have been deriding the quality of the students and the quality of the physicians who graduate from international medical schools as being inferior or second rate. And not only this study, but other studies that are also quoted in this research paper have all shown that the mortality rate, if anything, is lower for international medical graduates. The question is, why is that?
Sure. Well, Dr. Jacobs, I want to get to that answer, and I know that is a fascinating study of, again, analyzing mortality rates and using that sample of elderly patients admitted to hospitals in the United States. It's fascinating, but I know you know a lot about this subject of physicians shortages, particularly in rural communities around the United States, in some poor and rural urban areas around the United States, and medical schools, international medical schools, are helping to address that shortage. So let's talk about that for a moment and then get back to that study. Tell us a little bit about how schools like St. George's in Grenada is helping fill that need around this country.
Well, our students at St. George's overwhelmingly, or I should say to a very large extent anyway, elect to go into primary care specialties, that is, internal medicine, family practice, pediatrics, and some people would say obstetrics as well. About 47% of our last class went into primary care specialties. Now, our class is very large. For instance, last year, this present year that began in July of 2016, the academic year, we placed 871 of our graduates in first-year residency positions in the United States. 871. Now, that's more graduates in first-year residency positions than any other medical school in the world, just to give you an idea of the magnitude. Of that group, about half of them are going to go into primary care specialties. We try, because we have such a diverse student body, we represent on our campus 94 different countries. 70% of the members of the class are United States citizens or permanent residents, but 30% are not. 30% are international. if you go to the campus, I was just there for our clinical meetings, and walk around and see the students, it's like a mini United Nations. I mean, the magnitude of the interaction among the various ethnicities and religious groups and personality groups is really mind-boggling. And here's a huge school where 80% of the instruction is given in small groups of 8 students or less. So there's an awful lot of interpersonal interaction. The primary care issue is particularly acute in rural parts of America. First of all, any doctor it would be welcome in rural parts of America because there is such a need for medical care without driving 100 or 200 miles to get it. And as a result of the shortage, and the projected shortage is about 100,000 doctors short in the next several years, and that's not being addressed in the only way it really can be addressed by the Congress authorizing more money to train residents.
Well, Dr. Jacobs, we are out of time, but a fascinating study by the Harvard School of Public Health and certainly your work at St. George's University, certainly fascinating. Dr. Jacobs, thank you so much for joining us on the program. Well, we want to continue this discussion about the doctor shortage, continue this discussion about this fascinating study, and we'll be sure to have you back on in future weeks. Thanks so much for joining us on the program. Coming up after the break, we've got more tips, advice, and information here on Get Down to Business. Don't touch this dial.